Good evening. The practice of putting people experiencing mental health crisis in police cells has been halted in Devon and Cornwall.
In 2014, a lack of specialist beds meant more than 700 vulnerable patients were locked up alongside criminals. But figures obtained by ITV News have revealed it has now fallen to zero, thanks to a new law introduced last year.
Well, senior officers say they're proud of the new statistics, but acknowledge there's still a lack of mental health provision across our region. Sam Blackledge has this exclusive report.
A police cell can be a frightening place for somebody experiencing a mental health crisis. For 44-year-old Teresa, the memory of being taken into custody for her own protection 10 years ago is still all too raw.
I'd been very down. My mood had been down for quite a while, and I was very upset, and I'd been self-harming. I'd had suicidal thoughts. I spoke to a friend. She got very worried about me and she called the police, and they came, took me back to the station because they thought I was a danger to myself, which, to be honest, I probably was. And I was kept in a police cell for 8 hours. When you've got people banging on cell doors and shouting and stuff, that makes it very scary. It's a very scary place to be. I think it's actually quite damaging to be in a police cell like that, to be treated like a criminal, to be stripped of everything. It's not the place that you'd want to be.
Over the last 4 years, more than 1,000 Mental Health Act detentions in Devon and Cornwall have resulted in police custody. This adds up to almost 10,000 hours in a police cell for people who are often vulnerable and at risk of harming themselves. But the picture has improved. Year on year, the figures show a move away from this controversial and damaging approach. And we can reveal that so far this year, not a single person has been held in a cell under the Mental Health Act. Back in 2014, the issue was highlighted in a tweet by then Assistant Chief Constable Paul Netherton after a 16-year-old girl was detained in custody because no suitable beds were available anywhere in the country. Today, police bosses welcomed the new figures and said tackling mental health is a top priority.
Is a police cell suitable for a person who's broken their leg? No, of course it isn't. They actually need some kind of treatment, some medical treatment. And actually, a person suffering from a mental health crisis, they're going to be very distressed, they're going to be very frightened, they won't know what's happening to them. It is the last place a vulnerable person who desperately needs help and support, who's feeling completely overwhelmed by the situation, absolutely the last place they should be. Even looking back to where we were 4 or 5 years ago, absolutely shocking. And I'm very proud of the fact that since there's new legislation that came into being at the end of last year, we've not had a single person in our cells having been detained under the Mental Health Act.
It's very heartening to see the drop in the figures. I think that was the right thing to do at the time, to not take people with mental health issues to police stations, unless of course they've committed a crime, which does happen with some people. But there's still more to be done. There's still more needs to be done.
Around 15% of all calls to the police are linked to mental health, and senior officers remain concerned about the shortage of specialist beds around the country. It's clear that while progress is being made, the battle is far from over. Sam Blackledge, ITV News, Plymouth.
And Sam joins us outside the psychiatric unit at Derriford Hospital. Sam, this is clearly a very important issue. So just how significant is this new law?
Yes, well, in December last year, the new Policing and Crime Act effectively banned the use of police cells for people experiencing a mental health crisis. Instead, they're brought to places like this. This is the Glenbourne unit in Plymouth, an acute psychiatric hospital for people who are no longer able to safely live at home. Well, earlier I spoke to the matron here, and she explained why places of safety are so much more appropriate than police cells.
So when they come to us, they would be greeted very warmly by a nurse. They would have a physical examination to make sure that the cause of their symptoms isn't medical in nature. And then for the duration of the stay, they can watch television, they can have something to eat, they can shower if that's what they require and change their clothes. And then on a more human level, they can think about the reasons why they presented in crisis and work through some of those before the assessment happened. That's not something that could happen in custody, where a person was effectively left in a cell.
So, Sam, mental health clearly a complex and difficult issue. In your report, Teresa said more needs to be done, but what needs to happen next?
Well, these figures come after years of campaigning, and they're clearly being held up as fantastic news. But the wider issue remains a concern, because police officers in Devon and Cornwall are still being called out to around 700 people every year with mental health issues. So the issue that needs to be resolved for the region now is getting people the support they need at an early enough stage that they don't end up in this situation.
Sam, thank you very much. Sam Blackledge there. And if you've been affected by that report, do take a look at our website for advice and organisations to get in touch. There's the address for you. It's itv.com/West Country.
We're going to turn to other news in the region now, and a Royal Marine has admitted stealing over £60,000 worth